5 things to remember about salmonellosis due to Salmonella typhimurium. Remember, there are 2 species of Salmonella that are important in swine: Salmonella typhimurium and Salmonella cholerae-suis. Salmonella cholerae-suis will be covered in another video. Salmonella typhimurium is a zoonosis. It's pretty famous and pretty well known because it causes food poisoning in humans. It also causes clinical signs in pigs. It affects weaned pigs, usually in the few weeks after weaning, all the way until market-age pigs, and causes a yellowish diarrhea. When the pigs recover, they usually have a decreased growth rate and can still look a little bit smaller than other unaffected pigs in the group. The lesions are pretty characteristic. At necropsy, when you open the ileum, you will see what we call pseudomembranes. Pseudomembranes are yellowish debris in the ileum that are actually the cells from the mucosa that have been autolyzed by Salmonella. The other typical lesions are really well delimited circular button ulcers in the colon. These happen in the more chronic cases of Salmonella. Salmonella typhimurium is easily cultured and isolated from either fecal matter or from intestinal tissue. However, culture by itself is not sufficient to make a diagnosis. You have to have clinical signs like diarrhea in smaller pigs to establish a diagnosis. There are multiple antibiotic resistance reported for Salmonella typhimurium. Therefore, before you start a treatment, even though it can be very effective, you need to do a susceptibility sensitivity testing. Vaccination, usually oral for growing pigs, is available and decreases the severity of clinical signs. Of course, cleaning and disinfection of the barn is critical to avoid contamination and propagation of Salmonella between groups of pigs. Thank you.